Knock knock. Hello, Mr. Churro. Hi, I'm your nurse, Daniela, and I'm here to give some discharge information before you leave. I heard you're gonna be discharged today, so I'm just gonna give you the information about the medication that you're taking, as well as education regarding CHF. And I'm going to be doing a quick assessment before you be ready to go. So I'm going to start with what is a CHF. CHF is it happens when your heart cannot pump enough blood to meet the body needs. And because of that, when you came to the hospital, you were having a shortness of breath and swelling of the feet, known as edema. As well, there's a difference between right-sided failure and left-sided. And you were having the left-sided heart failure, which could cause a cough and the crackles that you were having. And the right-sided one, for extra information, it could cause increased blood pressure, ascites, just basically like a stomach, and weight like a stomach, and it builds up in the fluid in the stomach, and jugular vein distension, when you're around that area, your neck is very distended, and this could basically happen. So that's the difference between right-sided heart failure and the left. But in your condition of CHF, it just again what I mentioned, it causes shortness of breath and the swelling of the feet, and then as well, it's just when the heart cannot pump enough blood to meet the body needs. So that's why you came into the hospital. So now I'm going to be doing a quick assessment. I'm just going to be listening to your heart and to your lungs, and as well, I'm going to count your respirations. And I was notified you will not have any shortness of breath. Are you having any shortness of breath? No? Perfect. So I'm just gonna have a quick listen to your heart, okay? Okay. Okay, S1 and S2 is present. Now I just need you to take a deep breath in and out. Okay, your lungs are clear. And now I'm just going to check a quick edema in your legs. Okay, so you're having a little bit of edema, and this is what the doctor prescribed you two medications. We have your Lasix, which is known as your water pill, and this medication will help you remove the excess fluid of the body, and it will make you urinate a lot. So that's why it's very important for you to take this medication in the mornings, okay? The next medication that you'll be taking is digoxin. And with digoxin, it's very important that you be careful to monitor for digoxin toxicity, and that could be blurred vision and irregular pulse, and that could be caused when you're taking with the Lasix. And with the Lasix, it causes the low potassium to go low, and that increases the risk for digoxin toxicity. So that's what the doctor is going to be having you to monitor your labs. And I apologize that for digoxin, this medication will help your heart beat stronger, because it will help increase the cardiac output and decrease the ventricular filling. So that's what happens when to help your heart beat stronger. And this is just gonna help you overall. So if you have any questions, please give us a call through our discharge paper that I will provide. And as well, I can provide some information that you can share to the community about CHF, and even some information that you can read about to understand more about what is CHF and what caused it. Again, as well, the discharge paper, it will include the amount of the dosage of the medication. So you'll be taking digoxin 0.25 milligrams and Lasix 20 milligrams. So, and it will be by mouth orally. So I'm just going to give the papers to you, and I hope you have a wonderful day. Thank you for your time. Here's the discharge paper.